Hey everyone, welcome back. Today we're going to cover Chapter 4, the Integumentary System. Let's get started. Lesson 4.1, Anatomy and Physiology of the Integumentary System. We will recognize and use terms related to the anatomy and physiology of the integumentary system. Functions and specialties. The skin is the first line of defense. Healthy, unbroken skin is the initial defense against pathogenic invasion. It regulates temperature through shivering and sweating. The sensation perceived by the skin is the sense of touch. Receptors in the skin allows the individual to know when he or she is in contact with the environment. We will discuss terms that relate to an excessive sensation of touch, such as hyperesthesia, and the lack of sensation of feeling, such as anesthesia. Vitamin D is a substance important to normal development of teeth and bones, and is synthesized by the skin. Dermatology is the study of the skin. Dermato is our combining form for skin, and logi is our suffix for the study of the skin. For the study of, which makes dermatology study of the skin. A dermatologist, however, on the other hand, is the one who specializes in the study of the skin. Again, dermato is our word part for skin. Logist is our suffix for one who specializes. Therefore, dermatologist is the one who specializes in the study of the skin. Here's an image of the diagram of the skin that you can also find in your textbook. Pay attention to our epidermis, dermis, and subcutaneous layers, as well as all the accessories within the skin layer, such as the sweat gland and the sebaceous glands. And notice how the sebaceous gland is joined in with the hair shaft. We also have pores. Layers of the skin. Let's start with the combining forms for the skin. So we can say we have dermo, dermato, and cutaneo. Do you recognize any of these combining forms? The skin is arranged in layers. The top layer of the epidermis, epi meaning above, upon, derm again meaning dermo is skin, and is for a structure. Hence the term epidermis is the top layer of the skin. The dermis, also called the corium, is the true layer of skin. It holds the blood vessels, oil and sweat glands, and the nerves for sensation. Underneath this layer is called the hypodermis. The hypodermis, hypo meaning under or beneath, derm again meaning skin, and is for the structure. The other name is subcutaneous tissue. Note that sub means under or below, and cutaneo also means skin, whereas ous, that suffix is pertaining to. So two names both refer to the structure under the skin. This tissue is filled with fat, also known as adipo. Adipo is a combining form for fat. Sometimes you'll hear this referred to as adipose tissue. Let's delve in a little bit more to these layers. So we'll start with epidermis. The epidermis is composed mostly of avascular, a meaning without, vasculo meaning vessel, r meaning pertaining to. Tissue meaning that it is very limited blood supply. Covers the body and is arranged in thin layers. And these layers have a scaly appearance. The medical name for this structure is the stratified squamous epithelium. Squamo means scaly. Once the cells are formed, they are pushed upward towards the outermost layers. The stratum corium, corio meaning hard or horny. As they are pushed toward the surface, they are filled with a hard protein material called keratin. Remember, kerato is our combining form for hard or horny, and are then referred to as keratinocytes. The addition of keratin into the cells gives them a protective waterproof property. The deepest layer of the epidermis is the basal layer, also referred to as stratum germinativum. This is the site of continual new growth for skin cells, along with the production of substance such as melanin that gives the skin its color. Pigmentation is governed by the melanocytes. Remember, melano is our combining form for black, cyte means cell. That produces a dark pigment called melanin. In the presence of sunlight, melanocytes increase their production of melanin, providing a form of protection against ultraviolet light. Next, let's discuss dermis. Remember that the dermis is also called the corium. While the epidermis is the covering, The dermis is the tissue that is being covered. Vascular in nature and composed of connective tissue, the dermis is also the site of the nerves, hair follicles, touch receptors, and sweat and sebaceous glands. Let's move on to the subcutaneous tissue. So this structure is composed mainly of adipose tissue. Remember, adipose is our combining form for fat, which serves to insulate and cushion the body. Next, we'll get a little bit deeper on the different types of glands. The sudiferous glands, sudor, sudori, meaning sweat, and furus, meaning pertaining to carrying. Also called the sweat glands, are instrumental in the regulation of body temperature. Note that the combining form for sweat glands is hydroadeno, a composite of hydro for sweat and adeno or adeno for gland. You may see the term sudor used to mean sweat, but it is rarely used. Perspiration is a much more common term, and it occurs through tiny openings in the skin called pores. These pores are present on the soles of the feet and the palms of the hand, the axillae. Remember, axillo is our word part for armpit. Also, upper lip and the forehead. Then we have the sebaceous glands, which secrete an oily substance termed sebum, which serves to lubricate the hair and the skin. Note that the combining form is not tricky, it's simply sebo. Hair and nails. The combining forms for the hair are tricho, pronounced like trick or treat, and pilo. You can use this little word association to hopefully help you. Think she has maybe a tricky hairdo, or she has a pile of hair on her head. I hope either one of those will work for you. The root of each strand of hair is in the dermis along with its covering. It is referred to as the hair follicle. That combining form is folliculo. The part of the hair that you can see is called the shaft, and underneath the shaft is the nipple-shaped structure called the papilla. You will find that the combining form for papilla, papulo, is used throughout terminology in terms for the eye and obviously for the female reproductive system too. The cells on top of the papilla are responsible for the formation of hair. When these cells die, for whatever reason, hair loss occurs. The nails have two combining forms, onycho and unguo. They cover the dorsal surface of the distal ends of the fingers and toes. Remember that dorsal pertains to the back and that distal means far. The visible surface is the nail body, also called the nail plate. Remember, the body has to lay in the bed, with the nail root being just under the skin and the base of the nail. The nail bed is the highly vascular, which means it's blood-filled, tissue underneath the nail body. And the small moon-like area at the base is called the lunula, meaning a tiny moon. The cuticle, or the eponychium, is the skin upon the nail, and the perinechium is the small fold of skin that is at the sides of the nail, meaning literally near the nail. I did want to mention before we move on from this slide that you'll notice for hair and nails we have two different word parts. So tricho and pilo, one's Latin, one's Greek, and also we have two different ones because one's used for diagnostic, whereas the other one would be used for like anatomic location. Like for nails, subungual, that's going to be anatomic location under the nail. Onychomycosis, that's nail fungus. Remember, that's for a diagnosis. So I just wanted you to be mindful of the reason why sometimes there's two different word parts. Lesson 4.2, Pathology of the Integumentary System. We will recognize and use terms related to the pathology of the integumentary system. Terms related to skin lesions. A lesion is any visible, localized abnormality of the skin. Primary skin lesions are ones that initially occur as the result of a trauma or disease. Secondary lesions are those that have evolved from their primary form. Let's discuss the differences between these terms. So first you'll see nodules, which are palpable, meaning you can feel them. They are solid lesions, for example, a lipoma. Cysts are nodules that are filled with a semi-solid material, like a keratinous cyst is also called a sebaceous cyst. Remember, sebum is our oil. Then we have tumors, which are nodules that are larger than 2 centimeters. slightly less than an inch. The term tumor can be used to explain any mass or swelling, including neoplasms. Then we have hematomas. Hematomas are collections of extravasated or leaked blood that are trapped in the tissues and can be felt by the examiner. A petechia is a tiny ecchymosis in the dermal layer. What's an ecchymosis? An ecchymosis is a hemorrhage or an extravasation of blood into the subcutaneous tissue. It's non-palpable, which means rubbing your hand over it, you may not feel anything, but generally darkens the skin. You may recognize it by a common name as a bruise. Then we have purpura, which is a massive hemorrhage into the tissue underneath the skin. All of these terms are forms of extravasation, which means the process of any substance, whether it be blood or lymph, leaking outside of a vessel into surrounding tissues. Next, let's review what a macule is. A macule is a flat, non-palpable blemish or discoloration that is less than 1 centimeter. Examples include freckles, port wine stains, or even tattoos. A patch is a large, flat, non-palpable macule that is larger than 1 centimeter. Again, this could be a large port wine stain or a tattoo. Then we have a papule, which is a raised solid skin lesion that is less than 1 centimeter. A pimple is an example of a papule. Then we have a plaque, which is a raised plateau-like papule larger than 1 centimeter. Psoriatic plaques or seborrheic keratoses are examples. Finally, we have a wheal. A wheal is a circumscribed, elevated papule that is caused by a localized edema. Examples are bug bites, urticaria, or hives, which are wheals that are caused by an allergic reaction. Then we have a vesicle, which is a circumscribed, elevated lesion that is filled with fluid and smaller than half a centimeter. If it's larger than half a centimeter, it is termed a bulla. In English, we refer to these as blisters. Then we have a pustule, which is like a vesicle, but it is a raised lesion that is filled with pus as a result of an infection. Finally, we have telangiectasia, which is the condition of dilated superficial venules and capillaries. Word parts: tele means distant, angio means vessel, and ectasia means dilation. Let's discuss some terms related to secondary lesions. So if skin is atrophied, it is characterized as being paper-thin or wasted skin. An example is the thinning skin of elderly or stretch marks that result from rapid weight gain. The specific term for stretch marks is striae. Don't confuse that with the term for the layers of the epidermis, strata. A cicatrix is a scar, while a keloid is an overgrowth of tissue at a site of an injury. Eschar is dried serum, blood, or pus that can occur at the site of an injury or a burn. Commonly, we know it as a scab. A fissure is a crack-like lesion of the skin. And then an ulcer is a circumscribed crater-like lesion of the skin or a mucous membrane. It's important to note that ulcers can occur on the outer surface of the body as well as on the inside. Now let's review some terms related to dermatitis and bacterial infections. Atopic dermatitis is a chronic pruritic superficial inflammation of the skin that usually occurs in families that have a history of allergic disorders. Remember, pruritic means that it's pus forming. Cellulitis is a bacterial inflammation that is diffuse, spreading, and occurs within solid tissues. Contact dermatitis is an inflammation of the skin that occurs as an irritated or allergic response. Then eczema is the superficial inflammation of the skin characterized by vesicles, lesions that weep, and pruritus. Remember, pruritus is our word for itching. We're just itching for you to write us. Might help you remember this one. Eczema is also referred to as dermatitis. Then we have folliculitis, which is an inflammation of the hair follicle. Remember, folliculo is our combining form for follicle. These inflammations can be superficial or deep, and they can also be acute or chronic. More on dermatitis and bacterial infections. A furuncle is a localized superficial staph infection that starts in a gland or hair follicle and is characterized by pain, redness, and swelling. If two or more furuncles are connected by subcutaneous pockets, they are called carbuncles. Impetigo is a superficial vesiculopustular skin infection that is usually seen in children, and it can be highly contagious. Pilonidal cysts are located in the sacral region of the back and are cysts that form usually around a hair. Seborrheic dermatitis is an inflammatory scaly disease of the face and scalp. In children, it's commonly called cradle cap. Note the spelling of pruritus, Pruritus, meaning itching. It is often misspelled. Terms related to yeast and fungal infections. Candidiasis is a yeast infection that is also called monoliasis. Another term for fungal infection of the skin is dermatomycosis. Dermato is our combining form for skin, myco is our combining form for fungus, and osis is our suffix meaning abnormal condition. Naming the fungal infections by a specific body area is accomplished by using the term tinea for fungus and a secondary term indicating the area of the body. For example, we have tinea capitis, which is a fungal infection of the head. Capito is our combining form for head. Then we have tinea corporis, which is of the body. Corporo is our combining form for body. Next we have tinea cruris. Cruro means leg. This is of the groin, commonly called jock itch. And then tinea pedis is of the foot. Pedo means foot. And this is also known as athlete's foot. Terms related to parasitic infestations. Pediculosis is an infestation with lice, while scabies is an infestation with mites. Infestation with scabies causes an itchy pruritic papular rash. Note that these two are parasitic infestations and that the common names are lice and mites. Exanthematous diseases are those that are characterized by a rash, exanthem, such as measles, mumps, Fifth's disease, rubeola, and chickenpox are examples of exanthematous diseases. Herpes simplex virus, HSV. These viral infections cause clusters of small vesicles on raised inflammatory sites on the skin or mucosa. HSV1 causes fever, blisters, cold sores, hepatic stomatitis. They are all synonyms for each other. I would like to point out that the cornea is the hard outer covering of the eye. It uses the same combining form, corneo and kerато, as the combining forms used to describe hard, horny conditions of the skin. Remember that stomato means mouth, not stomach. That's gastro. Then we have HSV2, which is more commonly known as genital herpes. Herpes zoster is an acute painful rash caused by a reactivation of the latent varicella zoster virus, yes, the same one that causes chickenpox. This disorder is commonly referred to as shingles. Finally, we have verruca. Verruca is a medical term for a wart. These are caused by a virus and can appear on the skin in various locations on the body. For example, plantar warts appear on the soles of the foot, the plantar surface. And I would like to note that the plural form of verruca is verrucae. Terms related to disorders of the hair follicles and sebaceous glands. Acne vulgaris, vulgaris means common, not nasty, is the inflammatory disease of the sebaceous glands. The lesions are papules, pustules, inflamed nodules, and comedones, or comedo for singular. A comedo is a plug of sebum that partially blocks a pore. Open comedones are blackheads. Think that they're open so that dirt can get in. While closed comedones are whiteheads. They're still covered so dirt goes right over them, therefore the pus stays white. Then we have alopecia. Alopecia is the term for hair loss or baldness. Hair loss occurs for a number of reasons, including aging, disease, or genetic factors. Alopecia comes from the Greek term alopecia, meaning fox mange. Mange is an animal disease in which the hair comes out in clumps. Then we have hypertrichosis, which is an abnormal condition of excessive hairiness. Hyper means excessive. Tricho means hair, and osis means abnormal condition. A synonym is hirsutism. Think of hirsute is made of hair, hirsutism. A keratinous cyst is a benign cavity filled with an epithelium that has become hardened or keratinized. Sebum and epithelial debris. A synonym for keratinous cyst is sebaceous cyst. Finally, we have milia. Milia is a condition of tiny keratinous cysts that are on the surface of the skin. They are the result of clogged sebaceous ducts. Terms related to scaling papular diseases. Psoriasis. Psoriasis is a common chronic skin disorder characterized by circumscribed salmon red patches covered by thick, dry, silvery scales. Note its unusual spelling and pronunciation. Terms related to cornification and pressure injuries. Cornification means a process of becoming hard or horny, such as corneo, which means hard or horny. A callus is a thickening of the stratum corneum. Remember that top layer of the epidermis? That occurs whenever there are areas of pressure or friction. A corn, also called a clavus, is a mass of horny, condensed epithelial tissue that is over a bony prominence. It occurs as a result of pressure or friction as well. Then we have a decubitus ulcer, is an inflammation, sore, or erosion of the skin over a bony prominence. These occur most often in debilitated patients who are immobilized. These ulcers are graded by stage of severity, with the highest grade being 4, describing one that is so deep that it has eroded tissue down to the bone. Note that other names for decubitus ulcers are pressure sores or pressure ulcers. You may have seen them referred to as bed sores. The term decubitus comes from the Latin noun meaning a lying down and the adjective related to the elbow. Romans rested on their elbows when reclining. One assumes they eventually suffered pressure sores on their elbows from this constant position. Lastly, we have ichthyosis, which is an extremely dry skin. It is named by the combining form ichthyo, meaning fish, because of the scaly appearance of the skin. A milder form of dry skin is called xeroderma. Zero means dry. I like to think of zero moisture. A great way to remember it's dry. Terms related to pigmentation disorders. Albinism is a condition of a lack of pigmentation in the skin. Albino is our combining form for white. Melanin is a form of protection for the skin as well as the iris of the eyes. This is a particular reason why it's important for people with albinism to protect their skin, since those cells do not produce melanin. Next, we have dyschromia, which is comprised of terms dys, which is a prefix meaning abnormal, chromo, combining form meaning color, and suffix ia meaning condition. This is an abnormal condition of pigmentation of the skin. If an individual has less than normal pigmentation, it is referred to as hypochromia. If there is more than normal pigmentation, it is referred to as hyperchromia. Lastly, we have vitiligo, which is a condition of patches of the skin that lack pigmentation as a result of an acquired disorder of unknown origin. Terms related to disorders of sweating. This first term is abnormal condition of no sweating. We know our prefix "an" means no, not without, hydro means sweat, and our suffix osis means abnormal condition. Why is this bad, you might ask? Because sweating is a mechanism to help control the body's temperature. Next, we have hidradenitis, which is an inflammation of the sweat glands. Hydradin is our combining form, which is a compound combining form from hydro for sweat and adeno for meaning of gland. The suffix itis we know means inflammation. Therefore, it's inflammation of a sweat gland. Our next term features this prefix hyper, which means excessive, and again hydro meaning sweat and osis abnormal condition. Therefore, this is an abnormal condition of excessive sweating. Then we have miliaria, which is a condition of occluded blocked sweat glands. One thing I do want to mention here is don't get hydro with a Y confused with hydro with an I. Hydro with a Y means water, whereas hydro with an I means sweat. You can use this to remember the difference between water and sweat. Why not go swimming? Because you're going swimming in the water. Or I sweat, to help you remember that the I one means sweat. Terms related to pigmentation disorders. Albinism is a condition of a lack of pigmentation in the skin. Albino is our combining form for white. Melanin is a form of protection for the skin as well as the iris of the eyes. This is a particular reason why it's important for people with albinism to protect their skin, since those cells do not produce melanin. Next we have dyschromia, which is comprised of terms dys, which is a prefix meaning abnormal, chromo, combining form meaning color, and suffix ia meaning condition. This is an abnormal condition of pigmentation of the skin. If an individual has less than normal pigmentation, it is referred to as hypochromia. If there is more than normal pigmentation, it is referred to as hyperchromia. Lastly, we have vitiligo, which is a condition of patches of the skin that lack pigmentation as a result of an acquired disorder of unknown origin. Terms related to disorders of sweating. This first term is abnormal condition of no sweating. We know our prefix "an" means no, not without, hydro means sweat, and our suffix "osis" means abnormal condition. Why is this bad, you might ask? Because sweating is a mechanism to help control the body's temperature. Next we have hidradenitis, which is an inflammation of the sweat glands. Hydradin is our combining form, which is a compound combining form from hydro for sweat and adeno for meaning of gland. The suffix itis we know means inflammation. Therefore, it's inflammation of a sweat gland. Our next term features this prefix hyper, which means excessive, and again hydro meaning sweat and osis abnormal condition. Therefore, this is an abnormal condition of excessive sweating. Then we have miliaria, which is a condition of occluded blocked sweat glands. One thing I do want to mention here is don't get hydro with a Y confused with hydro with an I. Hydro with a Y is why not go swimming? Therefore, hydro with a Y is, let me just cut that part. Hydro with a Y means water, whereas hydro with an I means sweat. You can use this to remember the difference between water and sweat. Why not go swimming? Because you're going swimming in the water. Or I sweat, to help you remember that the I one means sweat. Now let's discuss some terms relating to disorders of the nails. First we have onychia, which is an inflammation of the nail. It is also called onychitis. Then we have onychocryptosis, which is an abnormal condition of an ingrown nail. Crypt means hidden. Onycholysis is a loosening or separation of the nail plate from the nail bed. Then we have onychomalacia, which is a softening of the nail. The suffix malacia means softening. Then we have onychomycosis, which is an abnormal condition of fungus of the nail. Remember that myco means fungus. And finally, to wrap it up, we have paronychia, which is an inflammation of the skin surrounding the nail. This can happen when an individual, for example, chews their nails and they become inflamed. Next, let's talk about burns. Burns are injuries that can be caused by heat, radiation, chemicals, or electricity. The severity is measured in degrees and in thicknesses. If degrees are used, there are first-degree burns, which damage the epidermis only. First-degree burns are characterized by erythema, which we know is redness, tenderness, and hyperesthesia, which is hyper. Remember, hyper means excessive. Esthesio means feeling, and IA suffix means condition. So this is a condition of excessive feeling. Therefore, the sensitivity to touch is heightened. Another name for first-degree burns is superficial burn. Then we have a second-degree burn. Those involve the epidermis and the dermis, with erythema, vesicles, and the likelihood of scar formation. These are also called partial thickness burns. If the burn damages the top part of the dermis, called the papillary layer, it is a superficial partial thickness burn. If the entire dermis is damaged, meaning that the reticular layer is included, it is referred to as a deep partial thickness burn. Then we have a third-degree burn. Those are the ones that damage the epidermis, dermis, and subcutaneous layer. Because the nerve endings in the dermis are destroyed, this type of burn does not cause pain. This is also called a full-thickness burn. Although not a common category, fourth-degree burns are those that destroy the epidermis, dermis, and subcutaneous layers, along with the muscle and or bone underneath. This is also called a deep, full-thickness burn. Eschar is the dried serum and blood that covers a burn. We've seen that in a previous slide. The rule of nines is used to describe the percentage of the body that is affected by a burn by dividing the body into multiples of 9. As you can see on the ventral surface of the body, 4.5% is allowed for the head and neck, 4.5% for each arm, a total of 9% for the front and the back of the arms, 18% for the front of the torso, 1% for the groin area, 9% for each leg, totaling 18% for the front and the back of each leg. That gives us 50.5% for the front of the body. On the dorsal surface of the body, again, we have 4.5% on the neck and the head, 4.5% on the back of each arm, 18% for the torso, 9% for the back of each leg. If the total back of the body is 49.5%, the total for the body is 100%. Terms related to benign skin growths. An angioma is a tumor of a vessel. Our combining form angio means vessel, and our suffix oma means tumor. Then we have a hemangioma, which is a tumor of a blood vessel. Remember, hemato is our combining form for blood. Then we have dermatofibroma, which is the fibrous tumor of the skin. These lesions are firm and round and usually appear on the extremities. Then we have a lipoma, which is a fatty tumor. Remember, lipo is a word part for fat. It is soft, movable, and located in the subcutaneous tissue. Some other benign skin growths include dysplastic nevus. A nevus is a pigmented lesion often presented at birth. It is also called a mole. That's what our layman's term is. There are various abnormal changes of a pigmented congenital skin blemish give rise to concern for progression of malignancy. Changes are categorized as A, B, C, D, and E. A, we first look for asymmetry. B stands for borders or irregular. Then we have colors, changes or uneven pigmentation. D is diameter, increasing size, or more than 6 millimeters. And finally, E stands for elevation. Next, we have seborrheic keratosis, which is a benign, circumscribed, pigmented, superficial warty skin lesion. And finally, we have skin tags, or acrocordons. Small, soft, pedunculated, which means it has a stalk, lesions that are harmless outgrowths of epidermal and dermal tissue, usually occurring on the neck, eyelids, armpits, and groin. Usually occurs in multiples. Now let's discuss some terms related to malignant neoplasms. Basal cell carcinomas are the most common form of skin cancer. They originate in the lowest layers of the epidermis and usually occur on the face and other areas that are chronically exposed to the sun. Basal cell carcinomas rarely metastasize. Then we have squamous cell. Squamous cell carcinomas are the second most common skin cancers. These arise from squamous cell instead of basal cells, although like BCCs, they are also the result of sun exposure. Malignant melanoma is the result of mutated melanocytes. It is the leading cause of death from skin cancer. Then, finally, we have Kaposi sarcoma, which is a rare form of skin cancer that occurs most often in patients with deficient immune systems. The nodules, usually red, blue, brown, or purple, usually occur on the extremities. Now we're going to review some disorders and diseases for the age-related matters of children and the elderly. As you can see in pediatrics, we have impetigo, acne, seborrheic dermatitis, cellulitis, pediculosis, and burns. Then for geriatrics, we have corns, calluses, pressure sores, eczema, actinic keratosis, cellulitis, fungal infections, and neoplasms. Lesson 4.3, Diagnostic Procedures and Therapeutic Interventions for the Integumentary System. We will recognize and use terms related to the diagnostic procedures and to the therapeutic interventions for the integumentary system. Let's review some terms related to biopsies. Each of these biopsies involves examination of living tissue. Remember, bio is our combining form for life and living, and then opsy is our suffix for viewing. An excisional biopsy is one in which the entire tumor is removed along with its borders as a means of diagnosis and treatment. Exfoliation is a scraping or shaving of samples of friable, which means easily crushed, lesions for examination. An incisional biopsy is a cutting of a wedge of tissue from a lesion followed by a sutured closing of the site. A needle aspiration biopsy is an aspiration of fluid from lesions for culture and examination. And then finally, a punch biopsy is the insertion of a tubular punch through the skin to the subcutaneous tissue to extract a core of tissue for examination. Terms related to laboratory tests. Bacterial analyses are cultures and serology of fluid removed from lesions to determine the type of bacteria. Fungal tests are scrapings of lesions such as tinea to determine the type of fungus. A sweat test is done to test the abnormally high levels of sodium and chloride that are characteristic of patients who have cystic fibrosis. And then finally we have an intradermal, remember intra means within, an intradermal test for tuberculosis is the Mantoux test. It uses purified protein derivative, PPD, to test for active or dormant tuberculosis. The Zenk test is used to test for herpes zoster and herpes simplex. Viral cultures are samples of vesicular fluid to help identify the type of virus in a lesion. Woods light examination is a method of detecting tinea or pseudomonas in burns. Wound and abscess cultures are samplings that identify pathogens in diabetic or decubitus ulcers, post-operative wounds, or abscesses. Now let's review some terms related to grafting techniques. Patients who need new skin may be candidates for skin grafting. A dermatome is an instrument to cut thin sheets of skin to be used for donor skin. Remember, dermato is our combining form for skin. Tome is an instrument to cut. Sources of skin can be autograft. No, not like a signature autograph. An autograph, which is skin that is taken from yourself. Remember, auto means self. Skin for the face could be taken from an area that is not so visible, for example, the buttocks. An allograft is skin that is taken from a donor of the same species. Allo means other. And a xenograph, xeno means foreign, and is temporary skin graft that is taken from another species. A synonym for an allograph is a homograph, meaning same. And a synonym for xenograph is heterograph. Hetero means different. Believe it or not, a xenograph can come from a pig. Finally, a flap is another term for a skin graft. These can be split thickness, meaning that they are from the epidermis and part of the dermis, or full thickness skin grafts that are the entire epidermis and dermis. Terms related to other therapies. Laser therapy is used to repair or destroy tissue, such as port wine stains, tattoos, or psoriatic lesions. Occlusive therapy is the use of a dressing that closes off an area of the skin to increase the effectiveness of absorption and the effectiveness of a medication. Remember, occluso is our combining form for closing. Lastly, we have Asoralin plus ultraviolet A therapy, which is the use of ultraviolet light on psoriatic lesions. Terms related to tissue removal. Cauterization is the burning of tissue in order to destroy them. Remember, cauterai or cautero means burn. Cryosurgery is the use of extreme cold. Cryo means extreme cold and is used to destroy lesions. Curettage is the scraping of material from the wall of a cavity to obtain tissue for a microscopic examination. The instrument used is called a curette. Debridement is the first step in wound treatment. It is the process of removing dirt, foreign bodies, damaged tissue, and cellular debris from a wound or burn in order to prevent infection and promote healing. An escharotomy is an incision into a cut, and usually to remove eschar, the scab that forms over a burn. It is done to prevent edema that can cause a lack of blood flow, which is known as ischemia, to underlying tissue. Then we have incision and drainage, which we'll know from the abbreviations IND. It is the cutting open and removal of the contents of a cyst, wound, or other lesion. Don't confuse with ID, meaning intradermal, which is pertaining to within the skin. IND is different from this. Next, we have Mohs surgery, which is a repeated removal and microscopic examination of layers of a tumor until no cancerous cells are present. And finally, we have shaving and paring, which is slicing of thin sheets of tissue to remove lesions. Terms related to cosmetic procedures. If you need your eyelids done, you would have to have a blepharoplasty. Blepharo is the combining form for eyelid. Plasty is our suffix for surgical repair. A chemical peel is the use of a mild acid to produce a superficial burn. This procedure is used to remove wrinkles and fine lines from the face. Then we have dermabrasion. Remember, abrasion is our suffix for scraping of. And this is a surgical procedure to resurface the skin. It is used to remove acne scars, moles, which we know as nevi, wrinkles, and tattoos. Then lastly, we have dermoplasty. Although literally the surgical repair of the skin is the transplant of living skin to correct the effects of injury, operation, or disease. A lipectomy is the removal, remember ectomy is our suffix for surgical removal, of fat, which we know as lipo. There we go, that's our combining form for fat. Then we have liposuction, which is the technique of removing excess adipose tissue with a suction pump device. And lastly, we have rhytidectomy. Remember, rhytido is our combining form for wrinkle. So rhytidectomy is a surgical procedure to remove wrinkles. This is commonly known as a facelift. Pharmacology, routes of administration. So because the skin is the initial protective barrier, in order to administer medications, they will either need to be in, on, under, or through the skin. First, we have hypodermic. Remember, hypo means under or below, so this is pertaining to under the skin. Then we have subcutaneous, also pertaining to under. Sub, meaning under, below, under the skin. Then we have intradermal, means pertaining to within the skin. Remember, intra is our prefix for within. Then we have topical, which is a type of drug that is applied directly onto the skin. It could be a cream, gel, lotion, or ointment. And finally, we have a transdermal therapeutic system, which delivers medication through. Remember, we have trans, which is our prefix for meaning through. So it goes through the skin by the use of a patch that allows for a specific time release of medication. Pharmacology. Anesthetic agents are drugs to reduce pain and discomfort. They can be given topically on an affected area. Examples of this include lidocaine and benzocaine. Antibacterials are drugs that prevent and treat bacterial growth. An example of this would be bacitracin. Antifungals are drugs that attack fungi. An example would be lotrimin. Then we have antihistamines, which are drugs that decrease itching by reducing allergic responses. Example for this would be Benadryl, Zyrtec, Claritin. Then we have anti-inflammatories that are used to reduce inflammation and pain. Examples of this are cortisone, Lidex, and Kenalog. Next we have antipsoriatics, which are agents that specifically treat psoriasis such as Devonex. Antiseptics are topical agents used to prevent infections by destroying microbials. Iodine is an example of this. Antivirals are drugs that are designed to decrease the effect of viruses, such as Valtrex. Emollients are topical substances that soften the skin, such as Lubriderm. Immunomodulators or immunosuppressants are agents that suppress the body's immune system. Elidel and Protopic are examples of drugs that are used to treat atopic dermatitis and eczema. Then we have keratolytics, which are topical substances used to break down hardened skin and shed the top layer of dead skin. They are used to treat warts, calluses, corns, acne, and psoriasis. Examples are salicylic acid, Benzac, and Condylox. Next we have pediculides, which destroy lice. Malathion would be an example of this. Protectives are topicals of sun protection factors, such as SPF. Retinoids are drugs that alter the growth of a top layer of skin and are used to treat acne, wrinkles, and psoriasis. Or examples would be Retin-A or Accutane. Scabicides are used to destroy mites and scabies. Examples would be Urex and permethrin. Finally, herbal medicine is used to treat some skin disorders. Aloe vera is used to treat sunburn and stomach ulcers, and tea tree oil is used for its antibacterial, antiviral, and antifungal properties. Alright guys, that's all I have for you today. Thank you so much for joining me.